My name is Wuti Papa Glover. I'm the Regional Nutrition Officer for Volta region. I grew up in this area, so I take my work to heart. Even though we were working hard, I could see malnutrition still remain a big problem, with children growing up stunted and many too exhausted to work. Yeah, the most frustrating aspects of what I do is when I put in so much effort, intervention, but it's not working.
There's a huge burden of undernutrition in developing countries that's largely preventable, and that's what we're really focused on.
A core challenge in nutrition is that we have all these global initiatives now to scale up implementation of nutrition interventions, but a gap remains in the capacity to deliver these interventions in communities and households.
So because of the lack of training opportunities and the lack of skilled workers in nutrition in most developing countries, World Vision has developed 2 distance learning courses in nutrition. They're designed specifically for staff who are leading the implementation of nutrition interventions in developing countries. These courses are online but guided by a facilitator. So a group of participants from different countries and different organizations works through the lessons together over a period of several weeks.
When I heard about World Vision Distance Training in Nutrition, so I felt right away I wanted to be part of it. So I signed up. Because the course is online, I could keep working during the training, fitting the coursework around my schedule. Yeah, you could say I got into it. When we were asked to provide local statistics in terms of anemia, I realized that Volta region is the highest in the country. Almost half of our people were affected. When I saw how bad the problem was, I knew we need to take action. The training also gave us new tools to tackle nutrition problems. We were given practical assignments and tools that push us to consider what we can do at the community level. Before the training, most of the time we would wait for somebody to come and support us before we do things on the ground. Now we have taken charge of the problem locally. We've instituted monthly monitoring of anemia for pregnant women, and we've trained local midwives and community health nurses on anemia and good nutrition. Another key insight I got from the course is the value of building partnership and sharing resources with other groups working on related issues. For example, we work with Ministry of Agriculture to scale up home garden to promote iron-rich foods. The training has been easy to scale up to the rest of our staff. Because it's online, we can multiply the benefit with almost no additional cost. From there, my staff can go out to the community and pass this knowledge on. We've already trained over 500 midwives and community health nurses.
By closing the capacity gap that exists in frontline nutrition work, we can fully realize the potential impact of current investment on nutrition. we need solutions now that take learning opportunities directly to where they are needed. The World Vision Distance Learning in Nutrition program does exactly that.
The next national survey is in 2019, and I think we can take voter reading from the highest rate of anemia in the country to the lowest.